2. Drug-Induced Psychosis. A Japanese patient developed psychiatric symptoms during treatment for epilepsy, and these symptoms were closely linked to a genetic mutation in his MTHFR gene, the C677T variant. This patient had a normal development from birth, and there were no major issues in his early life. But at the age of 10, he began exhibiting strange behaviors, such as suddenly running into the street, experiencing sudden sleep attacks, and even changes in his personality. By 13, he had his first seizure. After tests, he was diagnosed with frontal lobe epilepsy. However, despite trying multiple anti-epileptic medications, his condition was never effectively controlled. At 17, doctors prescribed phenytoin and phenobarbital, two common anti-epileptic drugs. To his surprise, 6 months later, the patient suddenly started experiencing auditory hallucinations and symptoms of multiple personality disorder. These psychiatric symptoms gradually worsened, even though the drug levels remained within the therapeutic range. Over time, his symptoms intensified, including emotional instability and cognitive confusion. When the patient was 23, he was hospitalized due to tonic-clonic seizures. After genetic testing, it was revealed that he was a homozygous carrier of the MTHFR677T gene mutation, meaning he had a problem with folate metabolism. MTHFR deficiency is a metabolic disorder that causes elevated homocysteine levels and lower methionine levels in the body. This metabolic imbalance severely affects neurotransmitter synthesis, leading to psychiatric symptoms. In addition, the patient had deficiencies in folate, vitamin B6, and vitamin B2, which further exacerbated his psychiatric symptoms. Doctors started supplementing him with folate, vitamin B6, and vitamin B12, and switched his medication to lamotrigine, replacing phenytoin and phenobarbital. Fortunately, after this treatment, his auditory hallucinations and multiple personality symptoms significantly improved. His mood stabilized, and his cognitive function showed recovery. This case teaches us that the symptoms of metabolic psychiatric disorders can sometimes resemble common psychiatric illnesses, but their root cause may be metabolic abnormalities, especially when psychiatric symptoms induced by medication don't improve